So another set of examples comes from the region of Waterloo, which has recently completed this new path research, which is coordinated by a number of researchers here in Alberta, in BC, and in Ontario. And the new path study, what this looked at is the idea of the urban built environment and physical and geographic access to healthy food in this study city of Waterloo. And what they found was really quite striking. You've heard the term food desert, and it's already been mentioned here today. But what this study illustrated is that the problem for and I would say the vast majority of Canadian jurisdictions is actually not food deserts. Rather, what we have in Canada, the evidence indicates, is a series of food swamps. So the definition of a food desert is usually a disadvantaged area with inadequate access to food retail, kind of major food retail like supermarkets. But what we have in Canada, even in the case of Edmonton, some of the recent research that's coming out is indicating that many disadvantaged areas actually have quite decent access to some sources of fresh produce. By the time we actually take into account affordabilities, like in the previous example I showed you, that's a different story. But on a purely geographic basis, the access is reasonably decent. But what we do have a lot of in most Canadian jurisdictions is an excess or predominance of energy-dense, nutrient-poor foods that are very easy to get. And the typical example is a convenience store. It's almost used as a proxy, and actually it is used as a proxy in some health research where we look at retail food environment indices, and actually the presence of fast food outlets and convenience stores is actually seen as a proxy for potential risks to health. Now, in the New Path study in Waterloo, what they found was actually this predominance of convenience stores was really striking. So that in any given kind of kilometer in a neighborhood, there was actually 6 times more access to convenience stores than to a major supermarket. So they were just there in the neighborhoods. Moreover, what they actually were able to do in the New Path study by linking this with diet and health measures was to illustrate that this really seems to have an association with diets and health. So that, for example, for an average woman living in Waterloo, for every kilometer farther away from a convenience store that woman of average height would live, the likelihood was that the weight would be reduced by about, I believe it was 15 pounds, and a waist circumference of 6 centimeters for every kilometer further away from the nearest convenience store. So geography really matters. But what we wanted to look at in this corner store environment was really, could we actually make healthy be profitable? There's been many attempts in the last couple of decades to do things like healthy restaurateur programs, healthy retailer programs. Often these are based on kind of certification models, and if you remove your tobacco from the front of your store, and if you do a certain set of things in terms of promoting sugar sweetened beverages, we'll give you some kind of certification. However, this really doesn't actually address the idea of retailers being innovators and entrepreneurs in their own right that might be able to give us some insights about how this retail setting works and how health promoting interventions could be adopted into it. So there's been some really interesting work coming out of both Canada and the United States. This illustration is from a group called Change Lab Solutions that works out of California. And what they've talked about is that the policy environment for retailers needs to be just as just as well thought of as the policy environment right at the consumer level. So this means thinking about the regulatory impact every time we think about the health impact of a particular new tax model or a new way in which we decide how convenience store owners should operate. The second great example of a model that's being used is urbane development. This group is based out of Philadelphia and New York City. And what they've promoted is actually called the Healthy Corner Store model. And the Healthy Corner Store model, as you can see from this illustration, doesn't have at the middle of it people or consumers. What it has at the middle of their model for a healthier food environment is actually sustainable grocery stores. Because, again, at the end of the day, without a viable business model, a profitable business model, we can never expect this sector of the food system to be able to work to its optimum in terms of optimizing and promoting health. So I'm going to show you another example from some of our pilot work in Toronto. This is Lucy's store. This is in another low-income tower community in East Scarborough. And we're working with a variety of partners. And Lucy's store is actually right down there at the base of one of the apartment towers. And what you'll see is this is actually the front of Lucy's store. So if you can imagine if we actually designed Co-op and Safeway stores this way, I think it would be very difficult for anyone to ever shop there, but people do. And the reason for this is because there's a long legacy of existing policies and municipal bylaws that make it very, very difficult for Lucy to actually run her business, let alone a health-promoting business. So actually, even those signs that you see there that illustrate what kinds of products that she has in her store are actually slightly illegal. That's the term that we would use. This store is also not allowed to have an entrance to the outside of the building because it's in a residential apartment tower, and it's intended only for access by the residents themselves. Inside the store, this is not unfamiliar to you for anyone who's been in a convenience store lately. The major infrastructure feature is, of course, the fridges, which she receives through a partnership with beverage companies, and it enables her to have infrastructure so that she can run her store. So we began to actually implement this Healthy Corner Store model, working with Lucy and her husband Yan to see what kinds of innovations that they had long been interested in doing, not necessarily to be more health promoting in their store, but actually to make their store a more pleasant and interesting place to shop for the local community. So the first thing was actually to move the soda fridges. And we didn't totally take them out. You know, they're still there. They're not in this picture. But they are on another wall in the back of the store where they're not the kind of first thing immediately when you walk in there. And instead, we began to think about how we could make this a really pleasant place to shop, just like going into any co-op store or any well-stocked large supermarket. So working again with a series of community and also business partners, we've had a lot of advice from a retail consultant as well as, a design firm. They began to help us to think about what kind of products could Lucy begin to keep that wouldn't actually impose too much in terms of practical or logistic burden for her, and yet could be presented in a really attractive, appealing way, marketed, really. And we also put in a window. So that now the store has this natural light. Again, I'm trying to illustrate that the vast majority of what we did in this intervention was not actually about the food that we put there. It was actually about thinking through her experience as a retailer and our experiences as consumers shopping there. So this model, we're beginning to think about how we could introduce this and scale out across Canada. There are some municipal governments that are already thinking through this model and implementing similar kinds of approaches across Canada. Most recently, we're beginning to look at, in partnership with actually our health region, Eastern Health, in the city of St. John's, to look at how we can think about the Healthy Corner Store model in Newfoundland and Labrador. And again, it's a matter of really adapting the model to the local context, to think about what's already happening in terms of local innovation. So, you know, the things that would work in East Scarborough will definitely, I would say, not necessarily work in a rural town in Newfoundland and Labrador. In many cases, those retailers are already quite innovative in terms of being a mixed type of business, that sort of town general store model, and so we'll need to work with that. So the Healthy Corner Store model has received a little bit of attention in the news media. And some of you may have seen some of the more disparaging or more kind of maybe negative press about the Healthy Corner Store model, and the idea that actually, you know, you can introduce all of the avocado and broccoli you like, but people are still obese in that community. So there's been recent news coverage of, for example, Philadelphia or Washington, D.C. And I think that my answer to that is really, it depends on what problem we're trying to solve. You know, if we imagine that a healthy corner store in one neighborhood, without really addressing anything else about the rest of the neighborhood, is going to reduce obesity, I think that's actually just naive. But what we're really trying to do is actually to strengthen that part of the food supply chain in terms of her being a viable business, in so far as that we can begin to make these connections across the food supply chain in a more health-promoting way. So the third example that I want to share is about following the food. So this is a picture, this is not the worst picture I could have chosen of the city of St. John's in the winter time, but it was a good one because people were navigating this. And what we actually see when we're looking at the retail environment in downtown St. John's is that people are innovative. I guess maybe the moral of this whole presentation is about people climbing over existing barriers. So what we found when we began to talk with business owners in St. John's is that they were running food businesses, but that they didn't really want to talk about food. What they wanted to talk about was parking and snow clearing. And in fact, this is GJ, the Vice President of GJ Shortles Limited, which is one of the 5 remaining family-run distributors of wholesale distributors of food products in Newfoundland and Labrador. And he actually attended there was a big snow clearing public consultation because last year's snow clearing was actually quite contentious. And there was a lot of promises that it would improve this year. It has, but mostly because we've had less snow. But in any case, what Chris Shortle actually explained at that meeting was that the snow clearing wasn't just about the consumer. The snow clearing was actually part of his human resources and his occupational health and safety policy as a small business owner. Every time he or one of his workers actually has to go to make a delivery in downtown St. John's, it's actually very difficult for them to find a parking space. So even for those restaurants that already provide him some guarantee of parking, inevitably someone has already pulled up in there and is just running in for 2 minutes to get their coffee, making it very difficult for him to run his business in a profitable way, let alone a health-promoting way. So what we're beginning to do and what we're seeing across Canada at the municipal jurisdictional level is that people are beginning to have these conversations, not about food, but really through the lens of providing food and food supply chain. And this is a really great report, if you haven't seen it, co-produced by the Canadian Agri-Food Policy Institute, as well as a couple of the food policy councils across Canada, looking at a number of different examples of ways in which cities are initiating councils, initiating meetings, or really initiating conversations with their retailers and entrepreneurs to think about how the food supply chain could support customers better as well as retailers better. This is already translated and scaled to some municipalities adopting food into their official plans. So for example, London's just recently put out a new official plan that actually has over 90 mentions of the food system within that urban plan. Other cities are taking up things like municipal food strategies to begin to think about how food actually links those issues of social equity, community development, economic development, and sustainability, all in kind of one lens. Finally, the economic development angle is really being scaled up in particular cities that are beginning to do things like food business incubators. So food is actually a great business example for many people who are wanting to take on entrepreneurship, and there's a really great interest in it in terms of small scale and, for example, artisanal production in some cities. So the city of Toronto, for example, has a food business incubator, and this is again another conversation that's happening. Finally, at the international level, what we're seeing is that municipalities are beginning to get together, across jurisdictions rather than thinking only vertically. So this is really that idea of that horizontal network of policy actors right across the globe. So this is from a meeting coordinated by a series of municipalities in Bonn, Germany, thinking about resilient urban food systems worldwide. So by now, and I'm just about to wrap up here, but by now you're thinking, so what's in it for me in my day-to-day work as a professional agrologist? And so what I'd like to share with you is that I need you. Health needs professional agrologists and business owners and business developers and marketers in order to be able to do its work really, really well. I started off my career actually as a community pediatrician, and now I spend, as you've seen, most of my day as a researcher and muckraker. But as a health professional in clinic, I spent most of my day thinking about consumption. It was really focused at this level. Nowadays, my work, with the help of friends and colleagues in municipal government, in business, and in urban planning, we begin to be able to increase our health lens to these parts of the food system. So what I need your help with is to be able to do this. And moreover, this year is the FAO International Year of Soil. And we need to begin to adopt these ecological models within health to also accommodate thinking through ecology of soil to sky. So what I'm asking you to do, and what I hope we'll get into some conversations over the break, is to help me see where the innovations are happening in your sector, so that we can begin to think about how we can test those and to document the dietary and health effects. And finally, to mobilize the right players in the system to begin to scale that up for a healthier and more sustainable food system for all.